Welcome, people who have joined. I'm going to give a little bit of time for people to come in. So in this session, people will be able to unmute, which is much nicer. I'm sorry that we're not in person, but it's how it is. And so I'm hoping that this could be a little bit more like a conversation and not have to just go on for too long. So I'm gonna start. We have 25 people in the room, so we're gonna quickly go around and if you know this in this session, the focus is on the journal, Health Literacy Research and Practice. So if people could introduce themselves, say hi, say who they are, where they're dialing in from today, what institution you're at, and then if you do have any specific question relating to the journal, that'd be awesome. If you might be able to share that, just so that I get a sense of what's on people's minds and make sure that we address the issues in the room. So I'm Michael Pashu-Orlo. I'm going to try to go around, if I can, at least as the Hollywood squares are on my screen. If you could turn your camera on, if that's possible, when you talk to the group, that'd be awesome. I'm a general internist. I'm at Tufts Medical Center. I'm here now a year. I had been at Boston Medical Center for 20 years, and I'm the founding editor of this journal. And so I'm looking to share information about it, and also to hear what people's thoughts, concerns, or wishes are. So maybe we could go around. Victoria, I don't know if you could share, say hi, and tell us any questions you might have.
Okay, I don't think I can get my video, but hi, I'm Victoria Dollard from the UK. I'm in my last year of my PhD, looking at a health literacy mediator for a intervention strategy. So it's a formative evaluation looking at how we can improve health literacy in pediatric acute care and schools.
Fantastic. Thank you, Victoria. Grace, you might. Germano?
Sorry, I just popped on late and again missed the assignment.
Oh, just maybe your name, where you're from, and if you have any particular questions for me as the journal editor, or about the Health Literacy Research Practice Journal.
Got it. Sorry about that.
Yeah.
My name is Grace Germano. I'm from Ottawa, Ontario, Canada. I work at the Ottawa Hospital in a new patient education portfolio, and I'm just interested to learn. Just excited to get some thoughts going.
Okay, great. Parvanta.
Hi there. Just here to see what you have to say, Michael, and acknowledging that we both have white hair now.
Oh my goodness, that's accurate. Alex.
Hi, my name is Alex Nicolici, and I'm the health educator for the infectious diseases branch at the California Department of Public Health. And I too am just looking to get some information on this journal. In my position, I don't have a lot of opportunity to do research and submit articles, but I am sort of curious to see, if there's other submissions that are or pieces that are accepted that aren't full-blown research studies. So, sometimes like case studies and things like that. So appreciate it.
Excellent topic. I'll definitely talk about that. Lucia, maybe you pronounce Lucia. Lucia?
Hi, Lucia. I'm just trying to start my video, but not sure if it cooperates. Oh, maybe. Hi, everyone. So my name is Lucia Gadimi, and I'm a patient education manager at the Ottawa Hospital. in Canada, and I work closely with Grace, who introduced herself. And yeah, similar, just kind of looking to learn a little bit more about the journal and the types of articles, perhaps besides research, that would be published there, as we don't have a huge capacity for a research as it should be done. Right now with our small team, but really kind of looking, we definitely have enough material that we would love to share and, do some kind of knowledge transfer, perhaps in like original article or similar type.
Sure. No, fantastic. I definitely will talk about this. Jim.
Hi, I'm Jim Whitehead. I'm in Indianapolis, Indiana, USA. I'm the CEO of multiple health associations, and am really wanting to see how to embed and leverage health literacy more in those health organizations. Also a previous White House appointee, so I'm related to a lot of different things that health literacy is paramount to, and have been enjoying this entire meeting. And Michael, look forward to this discussion.
Thank you, Jim. Thank you very much. Cassie?
Hi, I'm Cassie Phelps. I am one of the coordinators for the Health Literacy Work Group at EPIC. So I'm not a researcher, but always trying to expand my industry knowledge. So just here to learn about the journal and what we can find there.
Excellent. Thank you, Cassie. Andrea Cook?
Good afternoon. My name is Andrea Cook. I'm a nurse by training. Sorry about that. I also have a master's in health promotion. I recently started a new position as a manager of health literacy at the University of Miami Health System, which is actually a new position within the Office of Patient Experience. And so basically, because it's new, I have a lot that I can develop, and I'm just trying to find out what resources are available, and so I can make sure that any program I implement has some evidence-based infrastructure below it.
Fantastic. Thank you, Andrea. Scott Kessler?
Hi, everyone. I'm Scott Kessler. I'm a health educator and communications lead in the occupational health branch in the California Department of Public Health. Work or interact with Alex on occasion and highly admire her, and interested to see how the conversation develops today. Thanks so much.
Thank you, Scott. Emily?
Hi, my name is Emily Coakley, and I'm a health editor with EBSCO Information Services. I help write and edit content that's designed for patients to designed at a reading level that's appropriate. So this is all been very helpful conference so far, and I'm just here to hear what you have to say.
Great. Julie Cox?
Hello, I'm Julie Cox. I work for Elsevier in their patient engagement business area. I manage a small team of editors who apply plain language skills and capabilities to clinical content. And this content is published and given out through EHR systems or at the point of care. I'm wanting to learn a little bit more about what's available through your publication.
Great. Thank you so much, Julie. And Natalie?
Hi, everyone. My name is Natalie Erasme. I'm logging in from Tampa, Florida, from the University of South Florida College of Public Health. I serve as a research analyst here, and I'm interested in learning. So I work more in behavioral research, so I'm interested in learning more about the ratio of like behavioral research on journals to clinical research articles that are published in your journal.
Excellent. Thank you, Natalie. Danielle?
Hi, my job title is Senior Marketing Coordinator, but I'm really a copywriter for Colorado Access, which is a Medicaid company. And I'm just kind of here to learn more. I use health literacy pretty much every day at my job. So just excited to hear more about the journal.
Thank you so much. Kayla? Kayla? Graham? If you're trying to talk, we can't hear you. Maybe in the meantime, Desiree?
Hi, good afternoon. Desiree Phillips. I'm with the University of Texas MD Anderson Cancer Center, and I'm a senior health education specialist, and we develop all of our own patient education content. We use health literacy practices and provide consults for health literacy, and I'm just here to listen and learn.
Thank you, Desiree. Lies? Lise? Yeah.
That's right. It's Liz. It's an abbreviation of Elizabeth.
Elizabeth.
My mother tongue is Dutch. I am based at the Catholic University of Leuven in Belgium. I have a background in pedagogical studies, and at the moment I'm interested in health education in schools. So I'm here to listen what you have to say about the journal. Thank you.
Thank you so much. Yes, Valerie?
Hi there. So my name is Valerie Thompson. I am health literacy and patient education specialist with Ontario Health, and I'm from Toronto. So just excited to learn more about the journal and the research that's going on right now.
Excellent. Thank you. Ellen?
Hi, I'm Ellen Posledny. I'm a program manager of editorial services in the communications department at Northwestern Medicine in Chicago. We oversee all of the patient communications that go out of Northwestern, so I'm always interested in learning best practices and really would like to see more research on kind of the business case for why health literacy is so important in health systems.
Yes, thank you. Excellent. Denise?
Hi, everyone. I'm a pharmacist working in a clinic in Singapore. Part of what I do is to vet through patient education materials. So I'm just here to learn more about health literacy principles and practice, and so that I can incorporate it into my job.
Thank you, Denise. Sean?
Hi, I'm Sean Steidinger, and I am an associate librarian for clinical services at the University of Utah's Eccles Health Sciences Library. And I am researching the role that medical librarians can play in increasing AYA, adolescent young adult health literacy, and hopefully in partnership with clinicians and caregivers. And someday, I hope I have some research to publish. So I wanted to hear more about the journal.
Great, thank you so much. Yunji?
Hi, this is Yunji. I'm from Northwell Health in Long Island, New York. I'm a health disparity researcher. I'm also associate editor at JGEM. I haven't published much on health literacy, but it's something that I'm interested.
Fantastic. Thank you, Yunji. Zainab?
I'm here, I promise. Hi, everyone. Hi, I'm a public health consultant at my company, ZRF Group. We work on public health education to the community, also patient-provider communication. I'm really interested in translating research and evidence that all of the researchers are doing into practice. And I'm interested in learning about opportunities to publish practitioner perspectives, since I'm not a researcher or academic currently.
Okay, thank you, Zainab. Janet?
Good afternoon, everyone. I'm Janet Hopscheid. I am a health educator and research at Rogers Cancer Institute of New Jersey. So my interests are in health literacy because usually I promote and educate the diversity and minority groups, especially the Latino and Hispanic population. So it's important to know the resources that we can utilize in order to provide the right information out there in research. Thank you.
Thank you, Janet. I think we were joined by Corinne.
Hi, good morning. Yeah, I'm Corinne Hajar. I'm a patient education specialist at University of California in San Diego. And I'm kind of new to the health literacy world and just trying to learn how someone can kind of get involved in health literacy research.
Fantastic. So thank you for those introductions. I hope that I can address people's, the questions that people put forward or areas of interest that people mentioned. So the first thing actually I wanted to do was to go to our website because that way, if I can find it here. No. No, that's not it. Okay. You can see the website now. Everyone, you should be able to see the website, right?
Yes.
Okay, thank you. So this is the website for the journal, and there's several questions people came up with were about what kinds of submissions that we take, and actually directly relevant for several people who spoke, in particular our colleagues from the north and from Ottawa. You both asked about, effectively about practice submissions. So there's several other people also touched on this topic. Not everybody's doing kind of traditional health services research or clinical epidemiology research or linguistics or communication per se. Some people are actually in practice, and this is part of the journal's mission, is to share best practices. So activities that do that and articles that can help explain what does it take to implement best practice and what needs to be understood for organizations as they bring practice in health literacy forward through their organization are also particularly interesting to us. So let me just do a little review here about some of the aspects of the journal. So this is the editorial board. We have a statistical editor, and then we have really a representation of health literacy people from kind of around the world even. There's some really a lot of the highest impact publications are represented well in this group. So people can check that out, but really what people kind of in the end need to do is to go to understand what kinds of submissions we have, information for authors. So let me just scroll for the topic that we're talking about, which was different types of submissions. So most of the submissions we get are original research. The next most common thing that we get is qualitative, original research qualitative. They're listed separately because qualitative studies very frequently require a longer text count, a bigger text number of words, word count. And so you can see that. But then we have this other category, which we call best practice. We don't really get enough submissions in best practice. This is people trying to show what they've been doing in their organization to implement best practices. And so I hope that for some of you, this is something that you could consider. And if you come to this site and you navigate to the author information, there's guidance for what do we mean by best practice and how do you organize such submissions. We tend to have very few reviews. There's been a lot of reviews already published in health literacy, So there's not, it has to be something really actually new to make it interesting. Brief reports, we get a fair number of brief reports, and you can see the parameters for that. Perspective pieces are really, I love to get them, and but it's nice if they actually are bringing a new perspective. There's plenty of topics still to be discussed. This is a topic, this is a submission category that we haven't really had submissions for, but that really would be great to start to have more and more, which I call mission and motivation. Why are you working in health literacy? What's your story, and how do you feel like your motivation continues to, even though the work is hard and long and not easy. And these other things are very directed towards editorials by invitation off of other publications, or if there's a letter that you feel like we've done something bad, you need to tell us about it. Letters to the editor. So then, just right below are the instructions for how to set those up. The best practice is the one that people tend to need more information on, because this is not a common submission type for many journals. So you can look here for how we want this to be set up. There were a few questions on this area, like what kinds of submissions, and maybe this best practice category was a new idea for some people. So I don't know if there are any questions about that, or if anyone wanted more information about any of those submission categories. Alex, this is something like you were talking about, I think. Or Zainab, you were about to say something?
I was actually going to ask, do you have any best practice, like examples of best practice for that best practice section, like a article that's previously been published that you think did a good job in that category?
Excellent question. Yes, so the field has several different. So I'm going to answer generally and then more specific. The field has several different evidence-based practices. People have done research studies about, say, teach back, for example. But then, okay, the best practice article is then saying, okay, we're trying to implement that in this complex organization. What does that look like? So that would be like an implementation oriented project. And, oftentimes those don't come along with all the bells and whistles of a big NIH funded study. More and more people like Yunji and I are going to try our best to get NIH to give us funding for such things. But sometimes organizations just are doing these efforts. And so best practice submissions are kind of geared towards those. So let me see if I can give you examples. So here's public stuff that's been published now, the latest publications, and I don't think we have any best practice ones that are in the most read category. Let's see. Yeah, here's one. So Cliff Coleman is, I don't know if people are familiar, has done most of his own work in establishing pedagogic guidance for like requirements for medical residents and medical students around the curricular agenda for health literacy in medical education. That's most of his work has been in that zone, but he also did publish this best practice for telemedicine article.
I have a question. Is there like a standard for evaluating the best practices before like submitting? Or like a recommendation around like how much evaluation you should be doing?
Yeah, so this is a bit tricky because we're trying to be flexible. We know that a lot of organizations in the best practice space are not don't have a large opportunity for extensive evaluation. So I don't really feel like there's one answer to this question, because it really will depend on the type of organization, the number of people that you're working with, the type of opportunity you have for data collection. Usually there is some indication that there's been an assessment of the impact of the work, but it varies a lot. So I don't want to give you like a prescription, because I don't think it really even quite makes sense. If you're a hospital, this looks very different than if you're a public health department. If you're, it's all over the place. This is geared as a submission category that hopefully should be able to fit for practitioners. And so the bar is lower than in the original data manuscripts. I don't know if that makes sense or feels reasonable, but I hope it does.
Yeah, thank you.
Yeah. Okay. Let me stop and then flip over to a different slide deck and share a different thing. Okay, so this is kind of some statistics for submissions and what's accepted, what's rejected over time, and you can see this field is still a smallish field. It really needs to grow, in my view. We would be able to grow the number of publications that we have if we have good submissions. We could have this grow. The journal is supported by IHA, but not with a completely open blank check. So in the beginning, there were no author submission fees, and it's free online, but there have now been the beginning of some author submission fees. There are no submission fees for anything other than original manuscripts, though. So best practice, no submission fees, never have been and never will. The same thing is true for perspective pieces and mission and motivation pieces. The only ones that have submission fees are for the original manuscripts. But even that, I usually find creative ways to help avoid it. So anyone who came to HARC 2023 can have a waiver of their submission fee by using the passcode HARC 2023 on the website. Then you'll be able to avoid any submission fee this year until next HARC. So that's like a whole year from now. And then, yes, Janet.
So when it mentions the withdrawn there, could you explain why were they withdrawn in the part of the 2022 and 21?
Oh, the two articles yeah. So those are articles that they were sent for review. They were sent back to the authors as a revise and resubmit, but then the authors decided to not redo them. They withdrew them instead of revising them.
Okay, thank you.
Yeah, so this can happen. For example, maybe I thought that the revisions requested were reasonable, but maybe the author didn't agree, or maybe maybe we misunderstood what they had the opportunity to do. And so what we asked of them wasn't either something that they wanted to do or something that they couldn't do. So sometimes, you can see sometimes there's a miscommunication about some details, and you'll see each year there are some things that are withdrawn. For example, I'm looking to see if the paper can make it, has the chance to make it. If I think there's no chance for it to succeed, then it'll be rejected without review. If there's a chance for it to work, then we get sent to review. Everything's peer reviewed. And I don't kind of proceed until I get 2 reasonable reviews. When I say reasonable, I mean that the reviewer actually applied themselves. You know, if the reviewer writes a note that says, "This is great. You know, I love Corinne. She's fantastic. You know, no revisions needed." Well, that's not a useful review, right? So that's the kind of scenario where I wouldn't count that as a review. We could talk more about the review process in just a bit, but effectively, sometimes there's a miscommunication and the authors say, you know, we're going to withdraw the submission. It happens a couple of times, you know, here and there. It happened 4 times in 2020, you know. Interestingly enough, if people hadn't quite realized it, but these are the countries other than the US that have the highest number of publications, at least in 2022. Iran had 3 publications from Iran, and Australia had 3, and Germany had 2. So there's really actually a fair amount of health literacy work being done in various parts of the world. These are some of the places some of the highlights, but it'd be great to have more. We have people on this call from Singapore, Canada, UK. You know, it'd be great to have more, and other places in the world. I tend to be a little lenient for places where health literacy is very new, just because I think we should be kind of encouraging health literacy to expand around the world as a research endeavor and practice endeavor. In terms of reviewers, the pool of reviewers is here in front of you, and you can see that they're from different places around the world. Here are the most common countries from which we have reviewers. This concept active review, that means they've reviewed in the last year. I tend to try my best to send manuscripts to reviewers in areas where they have expertise, where they have prior publications, usually that works best that way. There was a question, I forget who asked it. Maybe Corinne, you had said just looking for ways to get involved. You know, one of the easy ways to get involved is to become a reviewer with us. It's super easy to do so. You can send me an email, or you can sign up as a reviewer on the website. You know, you can indicate your areas of interest, and then I'll do my best to only send manuscripts in your direction in the topics of your interest. Of course, you could say no if you're not available at that time. But it would be great if you would. It's a great help to the journal. Every year, I do honor the reviewers, not just in a letter in the journal, but the top reviewers make a donation in their name to an adult literacy program here in Boston. And then also a letter goes to their program, to their file. If you're an academic, those kinds of letters help with promotion. Basically, the reviews themselves, they get rated, and then we take the top rated reviewers and honor them in that way. The journal's still fairly young, but we're beginning to be noticed in various places. If you don't use this website, I recommend it. It's called JANE, Journal Author Name Estimator, and it's a great way to learn about journals and to see what they're publishing and any topic you might search on. And it's a way to learn about to do cross matching of your searches from other places, because they draw not just from PubMed, but obviously they draw from PubMed, Medline Central. The journal is indexed in all those places, but does not yet have an index factor. I can explain this, but it used to be that the Thomson Reuters index factor was something you could apply for after 3 years of being a journal, but that product has been sold, and so now it's done in a different way, and they start listing journals, and actually they haven't published what their metrics are and when they'll list new journals, but I think we'll be listed this year based on what I've observed from other journals, from other new titles. And what I mean listed, I mean get an impact factor. So there's a bunch of statistics out there about all journals, and one of them is this impact factor. It's kind of evolved because they were sold about a year and a half ago, and so most academics are looking for new ways of measuring the impact of the journals, and we'll get one soon. There's all kinds of other ways to estimate kind of the impact of publications. This is, I guess I pulled these data about a year ago at this point. I should pull them again. You can see where people are reading them from and page views and all kinds of stuff. So let me stop there. Let me stop there and see about other questions people have. You know, the journal has to both lead the field and also follow the field. We get submissions in, but we also can put ideas out. And so if you have ideas for new perspectives or areas that need to be developed, I'm happy to engage with people about ideas for perspectives that they want to submit, or if you just would want to submit it, that's fine too. Okay, it looks like there were some items in the chat that maybe I didn't see. Oh, Claudia, you mentioned that you're at UCSF. Okay, yeah. Zainab, you said you're going to look at the best practices. That's great. Yes, the Jane site. I like that site. I find it useful. It's very fast, and then if you click on, what articles are published by each journal, then you can see what they're publishing on your topic, on your theme. And I tend to use that function. When I submit any article, I tend to go there, and then I make sure that any publication I'm submitting, any manuscript that I'm submitting, that I've cited from the journal where I'm submitting, I've cited their work in that topic. It's a way to show the journal that you're aware of what they've been doing in a given area. You don't want the journal to say, "Hey, we published on this topic," and they don't even know about that. They haven't cited it. It is very easy to make sure that you do so, and that's true for all journals. This is actually a big impact, a big effect on a journal's citation index is if the articles that are in that journal are cited by other authors. Yeah, that's a good one too. Yep. Thank you. Thank you, Sean. All right, so I've been blabbing for a while, so I'd be great to not, if people have any other specific questions or concerns or ideas for new things. I guess I should also mention we do also do special issues, and we currently have a special issue manuscript, a special issue journal that's being developed between me and Maricel Santos, fantastic adult education professional in health literacy out in San Francisco. Just awesome. So Maricel and I are working on a special issue in honor of Rima Rudd, Many of you probably are familiar. If you're not, I recommend reading any of Rima's work. Rima was at the Harvard School of Public Health for many years and has just recently retired. She's one of the kind of founders of the field, really, of health literacy. And so Marisol and I decided to do a special issue in her honor, in part all the different graduate students that she helped train over the years. But anyone could submit in a theme issue for Rima Rudd. But we're open to having other special issues and special topics. And so if anyone has ideas for special issues that they would like to be involved with or help sponsor or to get us to do, that'd be great. Send me an email, mpo@tufts.edu. I'll put it in the chat. If it's should be easy to find me. And there's just a ton of ways a ton of topics that we could make into a special issue. But we usually try to have a theme that we could generate some good excitement about. There's a question, Julie, in terms of searching topics in HLRP. I don't usually do that through the website. I do that through PubMed. HLRP is listed in PubMed, and you can search any topic, anything you want, and then within a journal in the PubMed search browser, if you type in the journal's title in PubMed, and then brackets journal and bracket, and then your search is just within that journal. I don't know if people, well, that's my search behavior is through PubMed. Tends to be through PubMed for any journal that's listed there. That way you don't have to navigate through each journal's separate site. Like effectively just build your own Boolean within PubMed. Like, for example, you can search a topic and then close bracket author in your name, and then that would be the same thing for author. You can do that with any of the search fields in PubMed. I don't know if that made sense, Julie. You might have to just try it in PubMed. That tends to be the front door that I have for most medical searches is PubMed. Okay, well, I think we have, yes. Sean, everyone does need a librarian. There is a whole topic to talk about. Thank you, Sean. There is a whole topic about librarians that that many people, I think, don't realize. But Sean, are you part of the NLM network of librarians?
I am not, but we have the Region 4, I think it's the Region 4 offices housed in my academic library. So I see them every day.
I see. Well, I think people don't realize that they can, approach the network and do research together, and then that would be kind of a priority for NLM if that could be worked out, like to initiate studies through the network. And then my sense is that opportunities for interventions through the network would be particularly welcome in this space of health literacy through the librarian network. I don't know if you have any exposure to that, but I've had that kind of conversation with people at NLM a few times.
Yeah, they also have a lot of funds that they are eager to give out to folks who are willing to go through the application process, which isn't too onerous. But yeah, that's a great way to get your research funded and cover any APCs you might run into in other journals. But yeah.
Yeah. One of the things about the special issues is that I can get rid of all the APCs as I get them, arranged to get them sponsored. And so it's just another reason why it's nice to arrange for special issues. They basically can take that issue off the table, which is nice to do for people, especially if they're not coming along with their own big funded research portfolio. All right, well, I hope that I addressed most people's questions about the journal. If you have a particular paper in mind that you're not sure if it's fitting, send me a note. I'm happy to engage. It'd be great if you would be open to being a reviewer for us. Yes, thank you, Sean. Everyone's got a code now for this year, and if I can do it again, if I can arrange the sponsorship again for that kind of a special code thing, then I'll do it again. The whole, I don't know if people kind of realize this, but the whole way that journals have been funded in the past and how funded in the future, it's all in flux, and pretty much it doesn't really exist very frequently anymore that people buy a relationship to a journal for as like a subscription kind of thing. That doesn't really exist anymore. It's more through organizational relationships, and then that leaves a lot of people out in the cold if you're at an institution that doesn't have those relationships. That like large organizational library that buys bulk packaged subscriptions to many journals, and so then there's a paywall. The way around that is to have APCs, unless you have sponsors that can manage that for you. And so one of my jobs as the editor is to effectively find ways around that. I see. Well, Sean, you're in costume. Oh,
yes, I am.
I think that means that you're actually shushing people for talking loudly.
Absolutely.
I see.
I have my bun.
I see. Well, I'm sorry. I'm going to take advantage of this situation to tell when my oldest kid is now 27, but when he was 7, his favorite joke was the following. I'm sorry. I'm going to take advantage of this situation. He would say, this guy goes up to the librarian and says he wants fries and a Coke. And the librarian says, sir, this is a library. What are you talking about? He said, oh, I'm sorry. I want a fries and a Coke. Okay, sorry about that.
Well played.
You're very polite because you're pretending like you hadn't heard that joke 1,000 times.
I've heard it a couple times.
Okay. Well, he told it better than me when he was 7. Alex, you have your hand up.
Yes, and I appreciate the discussion about librarians. I always wanted to be a medical librarian, so it's cool to just connect with everyone here. Questions about special requirements for being a reviewer? Do you have any?
No, there are no special requirements, but all reviews that we get do get rated by me, on a scale of 1 to 5. And so if they're not good, then you don't get asked to do it again because it's not a good use of your time or my time or the reviewer's time. So I would not say there's any special requirements. Sean points out the possibility of training. So actually, one of the things that many journals do now is that um, that there's a checklist that goes along with. Thank you, Shirley. Excellent. That there's a checklist along with doing the review, so that the checklist is a kind of a training, because it points out the different things that we want like feedback about, and so it's not really like a formal training, but just by doing the review and going through the checklist, then sometimes people have told me, they're like, oh, I forgot to, to consider this part or that part. And sometimes you don't have to write about just anything. You don't have to write about everything, because some of the checklist things are just, yes, that's good enough or whatever. But frequently, by going through the checklist, people then add other elements to the review. It's not really quite training, but it kind of helps people write the review anyway. Some people make extensive comments. The reviewing is not to be the copy editor. That's not, reviewing is not really, it's not necessary to say this word's misspelled, that word's, there's going to be another copy editor, right? That's not a great use of your time as a topic expert, as someone interested in this field, there's going to be another copy editor. The reviewing is really, much more of it is about conceptual issues, and you could say, this clarity is an issue here. I'm not sure what you meant. Fine, but the bulk of it really should be conceptually oriented in a way. It's also fine to say, I'm going to comment about this and this, but like, I don't have the skill to comment about this. That's totally fine. If you say, are there requirements? Well, yeah, there are some papers that have like particular statistical modeling or particular areas of methodologic specificity, but then I can I can see that, and I have other people who I can go to, and it's actually totally reasonable to say, this is what I'm giving feedback about, and I'm not giving feedback about this. That's like not what I don't know about that or whatever. Look at Sean's just like a font of resources, a fountain. I didn't mean like New Times Roman. I meant more like a source, a fount of resources. I think what happened was that, Sean, you asked the question, and then you answered it before even 5 seconds. Although I am also enjoying the Canadians both had some really noticeable accents from Toronto. It's really nice to hear. See, what happens before we close the session is that people have to copy all of Sean's links.
Yeah, but the accents are from Ottawa.
Ottawa. Well, I'll make sure to call it out next time.
Sounds good.
I just saved the chat. I love the 3 dots at the bottom of the chat column.
Oh yeah. How many years now I've been living in Zoomlandia, and I've never used the 3 dots at the bottom of the chat column. Excellent. So it's true. Well, I do. Thank you. Even with gray hair, what can you do? So thank you for joining me for this session. Well, you muted yourself, so unmute yourself and say what you really got to say.
It says mutual.
Oh, okay, I see. Fair enough. But you have your magician's hat on for Halloween as well. but only on your shirt. You have one on the chair. Nice. Now things are going well. I like the little skull there. That's a nice effect. Oh, yeah, excellent. Well, thank you everybody for joining me for this session. If it's your tradition to celebrate St. Hallows Eve, be safe and have fun. Public health announcement is like walking is healthy. Maybe not everything else that happens on Halloween is super healthy, but what can you do? And so be well. There's another session starting in just a few minutes. I think we can call it a quit for this one. And it'd be great to see you in the next rooms, if possible. And keep up your work with health literacy. It'd be awesome to get your submission to the journal, and look forward to seeing them. If you know a 7 to 10-year-old, please tell them our librarian joke, because it'll make them really happy. All right, be well. Bye-bye.
Bye.